Hey guys, it's Miss Reyes and Miss Ratcliffe. We're going to be going over your subcutaneous and insulin skill. But first, before we get into the actual skill itself, we're going to go over some of the sites.
So there's quite a few common sites that you can give a sub-Q injection for, but I want you to remember that you need to be looking at your patient. You're giving this injection into subcutaneous tissue, which is fat tissue. So if you have a larger person that has more fat on them, these are going to be easier to find than someone that's smaller and has less fat. So you need to make sure you're injecting into the fat layer. All right, so some of the most common injection sites that you're going to see insulin given in is going to be in the abdomen. And we have a little belly right in front of us. So it's very, very center in the abdomen, kind of below the umbilicus area is one of the most common sites. You can also give it in the outer part of the arm. So right there on either side. You can also give it into the thigh. So in that whole area of the thigh, there is a few other places that you can give it in the upper or lower back. However, I have never seen or given this in these areas. They're just not quite as accessible, but they are areas where there is enough subcutaneous fat for you to give it in, so it can be utilized. Please look in your book. I know there is pictures of sites, so it kind of helps you identify those. You are going to need to know where your sites are, so make sure you look at that. All right, so we're going to go ahead and delve into our skill. So first, we're going to review the healthcare provider's orders and the medication administration record for the correct patient, type of insulin, dose, route, indication, and time. We're always going to assess our finger stick blood glucose and check the last blood sugar. We're going to assess our patient for signs and symptoms of hypo and hyperglycemia. Also going to review in our drug book specific insulin onset, time, peak, action, and duration of effectiveness. We're going to assess the time and site of the last insulin done, so you will know when to anticipate overlapping of multiple doses of insulin. We're going to check for allergies. We're performing those 3 medication label comparisons and comparing to our MAR and our orders. For intermittent insulin, we're going to gently roll that vial between the palms of our hands to warm and mix the insulin. We're not going to shake it, okay? So this is going to be our cloudy, and usually it will appear clear, so you have to roll it to make it cloudy. So if Miss Reyes can show you, it's nice and cloudy now. It was clear, yeah, some sediment in the bottom. All right, so we have also gathered our supplies, so you're going to need both of your insulins. You need a insulin syringe, and you need some alcohol. All right, so once we've done that, we're going to make sure we pop the tops on both of our insulins and clean them.
I'm going to clean my hands first.
All right, so once we've cleaned those, we're going to, sorry.
You're fine.
We're going to select the correct syringe, gauge, and length of needle, and this will depend on your patient and their size. We're going to remove the needle cap and pull back on the plunger to draw the amount of air into the syringe equivalent to the volume of medication to be aspirated from vial 1. Okay, so this is clear to cloudy, so we're going to inject air into our cloudy first, okay? So we're going to give 10 of each. So Ms. Reyes is going to pull back 10 units and inject 10.
If you see that this is in your way, this clip, you can just swivel it so that you can see your numbers better.
So when you're pulling air out, you need to bring the syringe to eye level so you can see that the plunger is exactly at 10. Okay, so now we're going to inject our air into our cloudy vial first. Okay, then we're going to remove it. Do not aspirate the solution. Now we're going to pull back our plunger syringe again. We're going to draw up 10 more because we're doing 10 of our regular and 10 of our cloudy. And we're going to inject that into our regular insulin. We're not going to remove the needle. We're going to turn it upside down, and we're going to withdraw our regular insulin. We're going to withdraw 10 units, maintaining sterility.
I always go below, like more than 10, and I just push it up a little bit to the 10 marker. You can only do that with the regular insulin. You cannot do that with your Cloudy.
Okay, so I'm going to come over and verify this. She has 10 units, absolutely. Now she's going to withdraw it. All right, so we're going to draw the needle, and now we're going to go into our intermediate acting insulin vial, being very careful not to inject anything into it, because remember, we have regular insulin in there. So we're going to pull up 10. Now this one, you can't move this around. You have to get it the first time because you can't put any of that regular insulin in. So she should have 20 in there. I'm going to verify. Absolutely. So now we're going to remove the needle from the vial and recap the needle and label the syringe before walking to our patient's room. All right, so we have 10 and 10. All right, so once we get to our patient's room, we're going to wash our hands, perform our 3 medication checks. We're going to ask our patient where they got their insulin injection last, and we're going to select the correct site for injection, making sure you're rotating sites. Don clean gloves. Okay, we're going to clean the area that we've selected with alcohol swab by wiping with a circular motion, moving outward from the injection site. We're going to let this dry. We're going to remove the needle cap with the non-dominant hand by pulling it straight off. We're going to pinch up a fold of skin at the injection site, holding the syringe with the needle bevel up at 45 to 90 degrees, depending on our patient's size and the length of our needle. We are not going to aspirate this. We're going to tell our patient we're about to stick them and inject the insulin and then withdraw the needle. We're going to engage our safety device. Do not massage our insertion site. Discard the needle in the sharps container. Remove gloves and wash hands. We're going to observe the injection site for bleeding or swelling or any signs of adverse reaction. We're going to document on the MARA nurse's notes and monitor our patients for signs and symptoms of hypoglycemia. Please let us know if you have any questions.